This seems to be a very deliberate starvation campaign against the civilian population. So people are now telling each other all the time, if you are not killed, and we will be starved to death. The massive number of patients, like medical patients, people with heart conditions, with increased blood pressure, with diabetes, with cancer. Those people are not catching the viral headlines, but they are also suffering and slowly dying. The exact scale of deaths and suffering, it is more than we can possibly imagine.
Assalamu alaikum. I am Ahmed Ramadan from Muslim Network TV, and today we have a very special guest with us, Dr. Musallam Abukhalil. He is a doctor from Nusayrat in Khan Younis, and we are very honored to have him with us today. He just finished a 24-hour shift just yesterday. Dr. Musallam, thank you so much for joining us.
Thank you so much, Ahmed, for having me. It's an honor to be here.
No, it's our honor. So virtually what's happening now is because Israel is not allowing in journalists into Gaza, the doctors have become the journalists stepping in where journalists are absent. My first question is, please tell us about the situation right now on the ground. You know, you're obviously there firsthand. How bad is it?
So unfortunately, the situation in Gaza has been the worst since the beginning of this war. And the reason why we have seen this time and time again is that there is no effectively very limited humanitarian aid being let in, so that the starving population here in Gaza, who have lost their income and livelihood and homes, they cannot afford to buy or purchase anything from the market. They are now not able to access any assistance. And the reason why this is being done is that sometimes the civilian population is now being put under pressure. This seems to be a very deliberate starvation campaign against the civilian population. So people are now telling each other all the time, if you are not killed, and we will be starved to death. So you will not be safe from this war either way, if you are alive or dead. And it also has made people very desperate, that they threaten their own safety, their own life, to get some aid, to get some flour, some food parcels from very unsafe military zones. And just when I completed my 24 call yesterday, we have received just in the morning hours more than 7 people who have been killed while waiting for aid, to pick up aid from near these dangerous military zones. So they are pushing people to effectively kill themselves just to get some food for their families. And it has now also scored many cases just for people who are going there to get food. And there is also this distrust against the new humanitarian aid mechanism, which is now being controlled by the Gaza Humanitarian Foundation, which has bypassed or sidelined all the tried and tested effective UN aid mechanism. They are now using so the new aid mechanism is inefficient, is dangerous, and is not leading anywhere with alleviating some of the suffering here in Gaza.
I mean, Israeli officials are not even trying to hide the fact that they want an ethnic cleansing. They are using starvation as a weapon of war. They're boasting about it, and it's really disheartening to see the actual effects of it on the ground. You also spoke about the GHF. I mean, own internal whistleblowers have been talking about how they're openly firing on unarmed, starving civilians trying to approach these aid sites. And like you mentioned, you know, people there have a decision. Either they're going to starve to death or they're going to risk their lives getting shot at by Israeli forces trying to get some sort of aid. And it's been set up like this deliberately. So, you know, the world is watching this. And I think most of us here are in complete horror at the amount of just unrelenting destruction that's been taking place there. You know, I wanted to ask you, you as a doctor being there, what is like the sense of, you know, I mean, they're making their intentions clear, but has there been any other sort of explanation as to why this is happening, like what they want from people, or are they just telling them basically sit there and wait for the end?
Yeah, so what we think and we hear all the time is that there seems to be deliberate misinformation and confusion taking place across the negotiation table. They sometimes send out some reassuring and promising statements regarding the end of this war soon, and we have been hearing this for a very long time, and then it's going back to square one. Now people have lost all hope, almost all hope, regarding how this will end eventually. And even if this is going to end, people have now lost everything, and they have most people have nothing to go to, because for Palestinian family, which spent the majority of its life to save money, to build their home, to have a family house that they could use to live a comfortable life. Now, all of this is gone. Even if the war is ending tomorrow, the repercussions of this war and the psychological trauma that will leave permanent scars for Palestinian families, children, women, and men who will be still alive will have to live with all of this. So, in a sense, the war will not end. Even if the active conflict has, or the active war is ending, there is a war within a war that will come after the day after the war is ending. So we feel that there is like deliberate, decision to destroy all forms of life in Gaza, so that people will have nothing to go back to, and they will live permanently in a state of misery and loss, even when they, stop this war.
Yeah, a scar for Palestinians, but a stain on humanity, I think. You know, the world really has, you know, when we speak to a lot of different people, a lot of different communities, we're out in the public speaking to, you know, just the civilian population, community leaders, and I've never seen in my life so much support for Palestine, but at the same time the inaction of governments around the world has really traumatized also people watching this unfold and wondering how is this being allowed to happen. um, Dr. Musallam, I don't want to take too much more of your time. I just have a couple of more questions. The first one is, I'm just bewildered at how doctors like you, the real heroes in this, are able to operate and perform your duties in such very difficult circumstances. If you could just comment on that.
I think that the Palestinian doctors who are now working day and night in the hospital is, is permanently in a state of disassociation from the what they are seeing. So they perform their duty, and they never stop to think or process to think about what they are actually going through. The scenes of misery, the scenes of killing, the scene of scattered bodies and injured people have, in many cases, desensitized them to all of this. And this is something that they will have to it will have to catch up with them after the war is ending. So I think the emotional toll on the healthcare professionals, doctors, nurses, allied health professionals will wake up to what they have seen and witnessed during their work in the hospital systems and in the primary care centers after the world is ending. So we are trying to just be, you know, our thinking is only dominated by just doing our work and focusing on completing the shift, taking care of the patients, and then waiting for the next shift to do the same. So we don't have a moment, or we don't have the time to stop and think about what this is all going to mean for us, and if it's damaging us internally or not. And one thing I really want to mention is that this war is not only about surgical casualties or trauma casualties. It's also about the massive number of patients, like medical patients, people with heart conditions, with increased blood pressure, with diabetes, with cancer. Those people are not catching the viral headlines, but they are also suffering and slowly dying because they do not have enough medications to prevent unpreventable deaths. And I have seen this firsthand during my work. There are a lot of deaths inside our department which could be easily preventable if the medicines were there, and no one is talking about this. So in a sense, the direct number of people being affected and killed by this conflict is not only exclusive to how many of them were killed by rockets or bullets. It's also killed. They are also being killed by lack of medicines, by lack of consistent care, because many of those patients live in displacement camps and they cannot move. So if we want to really dig through and be accurate about the exact scale of deaths and suffering, it is more than we can possibly imagine.
Thank you for highlighting that. I think it's very important that people are aware. The issue is that Israel has done so much that they distract. You're not able to focus on one thing, from the flower massacre to bombing every hospital to now the starvation. It's just one thing after the other, that even when you start getting into the nuances of the effects of all the destruction and chaos that they're causing there, it becomes a lot to process. So thank you for highlighting that. um, I know that aid itself is not the issue. There are trucks at the border ready to come in. There are humanitarian organizations, aid organizations that are ready to come in and start distributing aid, food, all that. The issue is Israel is stopping it, and they've made it clear this is their plan. I just wanted to ask you, this is my last question. What is your message to the people that are going to be watching this interview? Um, what do you ask from them?
Well, my message is, first I would like to thank everyone who is um, making an effort to contribute to raising awareness and perhaps contributing financially and non-financially to the work of medical or non-medical organizations in Gaza. So we feel very grateful for that. And the second message is, we want them to continue. We want them to continue the momentum, to keep and maintain the momentum of making their voice heard, to speak to politicians, to put pressure to end this war immediately. And one thing they can also check out is the work that many organizations like the one that our team here in Gaza have created, the Dignity for Palestinians campaign, doing emergency assistance on the ground. They can check our work. They can follow us. They can connect with our content to see the updates from the ground, the little efforts that the community here in Gaza are still trying to do despite all the difficult circumstances. So this is the message. keep doing what you're doing, and do not stop until the war is stopped and the humanitarian aid is let in.
Dr. Musallam Abukhalil, thank you so much for joining us. Very powerful words and a very powerful message. Stay strong, stay safe. We'll pray for you. Jazakallah for
Thank you
joining us
so
today.
much, Ahmed. It's a pleasure to be in the program.
And this is Ahmed Ramadan with an exclusive interview with Dr. Musallam Abukhalil from Nasser Hospital in Khan Younis. Thank you so much for joining us. Please make sure to share this interview so the word gets out and people understand the situation that is taking place and unfolding in Gaza. Like the video, leave a comment, and stay tuned for more. Assalamu alaikum.